And now, ladies and gentlemen, please welcome CMO, Vice President of Medical and Scientific Initiatives, Dr. Russell Osguthorpe.
Wow! It is wonderful to be here together with you this morning. I am a little bit nervous. To tell you the truth, I have never thought that I would stand on a stage like this and look at a scene like this before. So, thank you. I really do appreciate your kindness. Leon was incredible. That musical number was amazing. Sitting behind and listening to it, I said to myself, I have to follow that. You've got to be kidding. But I'm going to try really hard. I think a little bit of an introduction would be in order. Tell you just a little bit about myself and how I found my way to doTERRA. I'm a proud husband and father of this crew. I love them with all my heart. They're why I show up in the morning. I'm also a pediatrician. I studied at University of Colorado, Denver Children's Hospital. Love that place with all my heart. It's where I learned how to take care of children. It will forever be a part of me. I left residency and did a fellowship in pediatric infectious diseases at Washington University in St. Louis. All right, the show me state, right over there. So I loved that part of my life, and I was faculty at Washington University for a couple of years before coming to Intermountain Healthcare to a custom-made position with Intermountain Healthcare, University of Utah, and Primary Children's Hospital. I was tasked with building a children's specialty group in Utah County, just a little south of us here in Provo. And over the last 10, 11 years, I was able to work with some of the most cherished colleagues of mine, building that little group. During that process, they taught me how to be a medical executive, and I really enjoyed innovating. It was there that I learned that I am an innovator. When somebody says something can't be done, that's when I get to work. I grind my teeth and I just get down in the dirt and I want to solve problems and do things that people don't think can be done, but that everybody thinks need to be done. So why did I end up at doTERRA from this particular position? Well, as I'm standing here in front of you, I'm really asking myself that question again. It is a little bit daunting to be with you, but I only have to do this occasionally, they say, so that's good. But the reason why I'm here, they're very familiar to you. To leave a children's hospital, I had to come to a place that had a beating heart. The Healing Hands Foundation of doTERRA is the beating heart of our organization. It is how we enter the world. I am proud to be associated with it. The hospital in Somalia is so exciting to me, providing care to over 500,000 people who have no opportunity to get health care, if not for doTERRA and the Healing Hands Foundation. That's really quite miraculous to me. Co-impact sourcing, helping hundreds of thousands of people lead a better life and become stronger together. This co-impact sourcing, I learned over 5 months of investigating this job, was integral to sourcing certified pure therapeutic grade oils. Without them, my position here wouldn't be possible, and I'll explain why shortly. Lastly, doTERRA Healthcare Initiatives, Meridian Healthcare, is why I'm here, to build something that has never been built before, a problem in American healthcare that has not yet been solved. I look forward to those kinds of challenges. The last reason I'm here is because of the culture and people here. I've known Dave Sterling and Greg Cook for over a decade. And when I knew them a decade ago, when doTERRA was barely beginning, and saw them get to work and do something that they thought was going to be really important, but that they knew the task was daunting and huge before them, they became better versions of themselves over the last decade. They are still them. And I love that about these two men. They helped bring me here. And after coming, I met people like Emily Wright and Dr. Hill who welcomed me, recruited me with open arms, and helped me find my way from Intermountain Healthcare to doTERRA. The culture of doTERRA is unique. I know you guys all know it, but for somebody who didn't know this and isn't familiar with this, you know you're different, right? I'm really proud to be associated with you. You are a unique group of people trying to change the world in your own little way, and I love that about you. So let's talk a little bit more about quality and purity. Like I said, I examined doTERRA for over 5 months. To do research on essential oils, consistency and quality are absolutely required. The type of research I do is medical research. It can't be done if you don't have consistent product. For if you did a study on an inconsistent product, one year that product would be at this level, the next year it would be here, and you cannot rely on results of medical studies if you don't have consistency. The whole industry is at risk right now of being commoditized. And to do this, to commoditize essential oils, quality has to be sacrificed. doTERRA will never do that. That's why I'm here. I am going to scientifically characterize what you already know about essential oils. This will bring essential oils, doTERRA essential oils, to a larger group of people. I chose doTERRA for the groundbreaking, dogma-shattering research that can be done on these products. So, let's take you through a few of doTERRA's healthcare initiatives and how we're going to do that. So first, we've heard already yesterday and today, pursue what is pure. This is our foundation for doTERRA's healthcare initiatives. On that foundation stands Meridian Healthcare, a clinician network, institutional relationships, and clinical research. These 4 efforts of Meridian working together will lead to efficacy studies, and efficacy is at the heart of all of doTERRA's healthcare initiatives. To help explain the research aspect of what I'm going to do at doTERRA, I want to teach you, if you'll allow me, a few things about clinical research. It's done in phases. The first phase is phase 0. I know they should have started with phase 1, but they'd already built phase 1 before they determined that they needed phase 0, so just do it. So phase 0 is consistency. Consistency is required, like I said. After you do phase 0, you can move on to phase 1. Phase 1 is pharmacokinetics or dosing. In the dietary supplement world, we call that serving size. And it has not been done in our field in a rigorous manner. It needs to be done. The second phase is safety. Prospective safety trials will be done under my direction that will allow us to better understand how to use these products for you and your family. And then the third phase is efficacy trials. We'll get there together. Who do I do this work with? I have this wonderful group of people that I've come to know. In the 5 months that I looked at doTERRA, I met most of them. We've hired some of them since my arrival. We have physicians, pharmacists, pharmacotoxicologists, molecular biologists, microbiologists, analytical chemists. The group of these folks are really, they were surprising to me. I wasn't expecting to find it. Most essential oil companies, in fact, I think we're the only essential oil company that has anything like this. And it's impressive. I'm privileged to work with each of them. That's the research. Let's talk about relationships. For a moment, I need you to think about a future state for doTERRA. Think about the kinds of relationships that we can build when we do this research. Science is collaborative, it's peer-reviewed, and it's published. A relationship is so much more than transactional. It's mutually beneficial. We want long-term relationships with institutions, scientific organizations, industry leaders, hospital groups, and systems that will allow us to take doTERRA into the next phase of its development. let me introduce you to some of those partners in the scientific effort to advance the science and understanding of essential oils. Last year, I was here at convention. You didn't know that, but I was. And I was checking all of you out. I was pretty convinced after watching this last year I wasn't coming. Well, I cannot do that. Here I am. But last year at convention, I listened to Mary Beckerly, the CEO of Huntsman Cancer Institute, talk on this very stage about comprehensive cancer care at the Huntsman Cancer Institute and how doTERRA was helping support that. Just last week, I participated in the groundbreaking of the Catherine F. Kirk Center for Comprehensive Cancer Care and Women's Cancers at Huntsman Cancer Institute. It is an amazing institution, one of the leading cancer institutes in the country. We are going to do some neat work together with Huntsman in the future. Second, later today, you're going to meet Dr. Doug Flora, the medical director of St. Elizabeth's Healthcare. They are a very large system in the greater Cincinnati area, northern Kentucky. All right. They provide care to over 315,000 people with over 3 million encounters last year. They're expanding their cancer center to 250,000 square feet in 2020. doTERRA is part of it. I don't want to steal Dr. Flora's thunder, but there's a very important announcement about our long-term relationship that he'll make later today. I count him now as a colleague and a friend. He's a gentleman, and you're going to have so much fun with him. I'm equally excited to introduce to you the University of Mississippi. All right. University of Mississippi's National Center for Natural Product Research is the only FDA Center of Excellence for Natural Product Research in the United States. We are partnering with University of Mississippi's National Center for Natural Product Research, that doesn't quite roll off the tongue, to do a lot of the clinical trials I spoke with you about earlier. Later, you're going to hear from Dr. Nicholas Kahn, the director of this National Center for Natural Product Research, and he'll detail some of the work that we're going to do together next year and in the future. Intermountain Healthcare, where I came from, is a nationally recognized center for quality and value. This particular system is unique. It's been, I won't go through all the stuff on the slides, but if we all practiced across the United States like Intermountain Healthcare did, Dartmouth did this research and found that Medicare would save over 40% of its costs if we just practiced like the doctors and caregivers at Intermountain Healthcare. I was proud to work for them. They are a wonderful system. Together we are exploring new ways that we can take primary care and evolve it into a truly integrative healthcare system. I'm looking forward to working with them on this and all of you in the future as well. Let's talk a little bit about Meridian Healthcare for a moment. Thank you. Meridian is why I came to doTERRA. The mission that Dave Sterling presented of changing healthcare and integrating healthcare is central to why I'm here. Meridian, however, has a very difficult job. It is trying to take two worlds that are widely separated from one another. Alternative medicine and evidence-based medicine, or the allopathic medical tradition. These two medical traditions, they don't like one another very much. And you know that. It takes a unique allopathic physician to care for you and your families, that will listen and not condescend. Meridian Healthcare is building a truly new integrative health standard from these two medical traditions. This is a complex, difficult task, one that in our 3 clinics that we currently have open, we've learned a great deal from over the last year. We remain committed to establishing a network of clinics across the United States. Currently, our flagship clinic on our main campus at Pleasant Grove, how many of you toured that? We saw so many buses go down. Yeah, It is one of the most beautiful clinical spaces in the state, I believe. It is a stunning space to take care of patients. We look forward to seeing many of you there. And our other clinics in Nashville and St. George have taught us how much work there is to do to take these two worlds and bring them together. We're going to do that work together with you. You'll hear more about that in a moment from my colleague. I want to speak for a moment about advanced preventative care. Advanced preventative care is our care philosophy at Prime Meridian Healthcare. It's more than just a concept. Advanced preventative care, if you can go back one slide, sorry, I pushed that too soon. Advanced preventative care takes a typical pre-clinic routine where you fill out forms and sit in the waiting room, and then you wonder if anybody actually read that stuff. It takes that pre-clinic routine and turns it on its ear. All of that work will be done prior to your arrival through a health coach, and that health coach will obtain not only your past medical history, your social history, and your family history, but your diet history, your sleep history, your exercise history, everything that helps you be more well and be more healthy. That information will be gathered and compiled, given to your provider, digested before you come in and sit down. The waiting room is no longer there. You sit down with your provider and the information that is gathered is discussed with you. Strategies are developed with you rather than being dictated to. This process is unique and it requires a great deal of training to do. We're committed to do it. The main reason why we do this is we want to help you decrease your dependence on prescription drugs. Imagine you and your family preventing episodes of illness rather than just dealing with them as they arise. So what can doTERRA healthcare initiatives do for you? Let me show you how these initiatives work together. doTERRA is again going to lead the way by building on a foundation of quality and purity and consistency, by doing clinical research, as we discussed earlier, through scientific collaboration with NCNPR, Roseman University, medical collaborations with St. Elizabeth Healthcare, the Huntsman Cancer Institute, Intermountain Healthcare, and Prime Meridian Healthcare clinics, where we will be able to do some of the studies that we just described. These initiatives will change the way you think about doTERRA and allow you to bring doTERRA to a larger audience, because there will be stories that those people need to hear before they can listen. We will help you learn how to talk about them. To help you do that, I would like to talk to you about something sciencey for a sec, all right? For lack of a better term. Let's talk for a second about pharmacokinetics. You can read that or take a picture of it, but pharmacokinetics is basically the science of dosing, and like I said earlier, in the dietary supplement world, the science of serving size. We actually have done some phase 1 clinical trials this year at doTERRA, and I'm going to introduce to you the data right now. Do you want to hear about it? Okay, these are the first phase 1 clinical trials on whole essential oils that doTERRA has ever done, and they are among the first the world has ever seen. So the protocol that I'm describing here was approved through an institutional review board for safety. And we tested the turmeric duocap, which Dr. Hill and Alex DeBell introduced to you yesterday. We tested the copaiba soft gel and lavender capsules in the doses that you can see there. We then gave those doses internally to our colleagues. And then we looked at their blood at the time points that you can see analyzed there over a 24-hour period. We analyzed their blood for the particularly important chemical compounds that you're all familiar with in these substances, in these oils, for the maximum concentration achieved, the minimum concentration, and the half-life. Half-life is how we get at dosing. So here's our first trial. So turmeric duocap dosing data. What we did is we there were 3 phases of the study. The first phase is we gave turmeric oil, only the oil, to a human being. That's the graph that you see on your left. Then we gave curcumin to another group, curcumin powder alone. Then we measured the half-life. Half-life is how long it takes for half the concentration in the blood to drop. And what you see there is turmeric oil had a half-life of 9 hours, and curcumin had a half-life of 14 hours. Now, those of you who have really good eyes can see that on the y-axis, the curcumin is not very bioavailable. How many of you already knew that curcumin is not very bioavailable? Raise your hand if you're a nerd. All right, good. I'm proud of you. So curcumin is not very bioavailable. The third group of patients that we tested, we gave both turmeric oil and curcumin to, and then we looked at their blood. What happened was that the curcumin bioavailability was increased 11-fold. You don't get that, obviously. That's a little more like it. Okay, I hear it. All right, so what we were able to show in this particular trial was that curcumin, which is not very bioavailable on its own, when given in a duo capsule with turmeric oil, curcumin, which has extremely important bioactive effects, increased its bioavailability in the blood 11-fold. That's important information. Good. Copaiba, anyone? Okay, so let's look at what happened when we gave copaiba. This curve is quite different. You see the dramatic rise as the concentration went from the stomach and through the liver and into the blood, but then you see a 2-phase drop. There's an initial steep drop, and then there's a slow drop. That initial steep drop has a half-life that is 2 hours long, and then it levels out and has a half-life of 12 hours. That's because beta-carophylline, which is what we were measuring in the blood, binds to the CBD2 receptor, and it is falling off, we believe, very slowly off of that receptor. So there's 2-phase kinetics in beta-carophylline and copaiba. So we take those two graphs, those 2 slopes, we average them together, and that gives us our half-life of 7 hours. This supports a once-a-day dosing strategy for copaiba. How do you like that? How many of you want to see lavender? All right. This is actually the curve that I'm most excited about. Lavender essential oil, as you know, contains high concentrations of linalool. Linalool is one of the most important chemical compounds in our essential oil family. And in this particular oil, linalool has a half-life that you can see is quite different than the others. Linalool's half-life is short. It has a half-life of an hour. How many of you knew that? Nobody did. You're the first people in the world to know that. So linalool has a half-life of 1 hour. I'm not going to give you a dosing recommendation for linalool this morning. There's more work to be done. Linalool acetate, as you know, is the other main component of lavender. And there's some very exciting research that we'll share with you in upcoming meetings about lavender. I'm just going to leave you all hanging. I'm sorry, I just get to do it. So, what's happening here at doTERRA? We are now building and giving to you products built upon a foundation of phase 1 clinical trials. I put that peppermint oil up there because there's existing pharmacokinetic data on peppermint. These products are built upon a foundation of phase 1 clinical trials, and you need to understand this data. This will help you talk to people who need this sort of information before they can hear you and hear what you're saying. The folks at the showcase, Cody Boma, and the folks who've helped me do this science are waiting for you. They want to talk to you about it. Go and talk to them and learn how to speak to this data. We will continue to pump this out and change the world of essential oils. We're going to turn it on its ear. So where are we going? We will be doing multiple phase clinical trials. Scientific and medical relationships will be integral to publishing this research and challenging dogma. PMH clinics and providers across the country will give us a network and a platform to do this research. Advanced preventative care will help change people's lives. We will help people prevent illness rather than treat symptoms, and put away prescription drugs when possible. Over the next 10 years for doTERRA, I see these initiatives helping achieve doTERRA's initial vision of putting essential oil, doTERRA essential oils in every home. Thank you for allowing me to be with you this morning. Very much appreciated. I would now like to introduce Dell Brown, my good friend and colleague, partner in crime at Meridian Healthcare. He's going to talk to you a little bit about our clinician network. Dell.
Wow. What a group. It's so exciting to be here with you. Thank you. The power of community to create health is far greater than any physician, clinic, or hospital. I love that quote. And doTERRA is one such community, unique and powerful. We have here in one large gathering, business leaders, healthcare professionals, scientists, agronomists, wellness advocates, philanthropists, many dedicated support personnel, and even a few would-be competitors. All united by our belief in the power of pure essential oils in improving health and wellness. So as a longtime admirer, it is now with honor that I take the stage for just a few minutes to introduce to you a concept with profound implications for healthcare, for patients, for doctors, and for doTERRA. Here are a few realities regarding healthcare in the United States that are important to understand. Per capita spending in the United States is more than twice the average of all other leading nations, and yet our health and longevity are no better. National healthcare expenditure will approach $4 trillion this year, about 18% of the GDP, and 50% of that expenditure is linked to lifestyle-related disease and could be avoided. 64% of Americans lack full confidence in the US medical system. But this is no surprise to you. Our health reimbursement model pays more richly to treat disease than it does to prevent it. Most American doctors are incentivized by throughput and not by outcomes. 20 years ago, my wife developed a serious health issue that for many years could not be diagnosed. Instead of answers, we got drugs. Eventually, we found an expert provider who was willing to listen, who took the appropriate time, and who was finally able to present a diagnosis and a pathway to healing. We learned firsthand that successful outcomes in healthcare require a trusting relationship, mutual respect, and good communication. Sadly, those qualities are in short supply. More than 40% of Americans use and want complementary and alternative therapies, but they are afraid to discuss them with their doctors, and they often feel condescended or belittled when they do. Almost 50% of Americans have used one or more prescription drugs in just the last 30 days, and yet many derive no benefit, and many experience serious side effects. Enter Meridian Health Clinics, where we are developing an integrated care pathway to reverse the course of chronic disease and to reduce dependency on prescription drugs. And guess what? We're succeeding in doing that. And we want more people to have access. But building our own clinics takes time. So why not find and work with like-minded healthcare practitioners who already work and live in your communities? So right now we are in the process of creating a network of preferred healthcare providers who will think like us. They will be generalists and specialists from different backgrounds and training. They will include board-certified physicians, licensed advanced practice providers, dental professionals, and others. They already practice integrative medicine and will recommend doTERRA products. If they don't know about essential oils, they will agree to learn, and we will teach them, and you will teach them. And they will know the difference between smell-good oils that are adulterated and certified pure therapeutic grade essential oils. Most importantly, they will treat you with respect and kindness. They won't be paid by doTERRA, nor will they compete with you by selling doTERRA products. We are working now with candidate providers who over the coming months will be a part of this network, and we will introduce them to you. As our model develops and evolves further, we will also expand in the future with further Meridian healthcare clinics. doTERRA will provide on its website profiles of preferred providers, their location and contact information. Our aim is to have several available within a geographic area so that you can choose or refer someone to these providers based on best fit. So here are a couple of illustrative examples. Meet Dr. Annie Jones, a board-certified family medicine doctor. She'll say on our website, I've been in practice for 15 years and love family medicine. I've been a long-time proponent of integrative medicine and use acupuncture, massage, and essential oils in my practice to help patients achieve better health and wellness. I welcome the doTERRA community to my practice and look forward to assisting you in aligning your wellness goals. Meet Dr. Doug Baker, a board-certified orthopedic surgeon. I've been in practice for 20 years and found through my patients that doTERRA essential oils could improve preoperative and postoperative care practices. I am eager to help provide a care environment in my clinic and in my hospital where patients who use essential oils will be welcomed and respected. As Meridian Healthcare refines its preventative health and wellness models, we will share them with our network of preferred providers. And we expect that as they interact with you and learn more about the health and wellness benefits of essential oils, that they will also recommend doTERRA essential oils to other patients, others who you might not have been able to reach yourself, others who may have previously been skeptical about the benefits of essential oils, others who will be referred to you to learn more and to become your customers. Thank you for being so kind and welcoming of me. I'd especially like to thank Greg Cook for inviting me earlier this year to learn more about doTERRA. You are indeed a special community and one that I count myself privileged to be a part of. Thank you very much.
When I went through my cancer and I was on a lot of side effect medications, I remember 20 different types of papers and I combed over every side effect and I saw just some really hair-raising side effects that really scared me. But I need to find a way to naturally do this as much as possible. So what did you think when I first brought up essential oils?
Well, you take a breath as the doc and you try and think, what is this patient trying to do? What is the goal here? And you try and put yourself in the patient's place and say, what am I not getting for them? What am I not doing for them that they need? It was pretty clear at that point you were trying to approach your cancer holistically, in a healthy, natural fashion. So I had to learn about it. I had to study this stuff myself and understand that what you're talking about is the judicious application of naturally occurring substances to try and make sure that you give your body the best chance to bounce back.
knew that you needed to hear as much science as possible. I literally felt like I had a degree by the time I produced all this information, because I knew it was something that you needed, that this was something that could benefit patients and just help patients bridge the gap on their emotions while they're going through treatment.
We've built a lot of that into our own practice even before now, where people have distress tools and a social worker is involved early. We have a nutrition expert who can come by and talk about the appropriate way to feed yourself on chemo. And as we talk about this new cancer center we're building, we're putting in a demonstration teaching kitchen to teach people how to rebuild their systems after we've beaten them up. And I think what we're learning is these are viable tools. And the fact that they haven't been adequately studied yet should just be motivation to study them.
What are you looking forward to the most with this new Integrative Cancer Center?
I love that for once I get to spend some time building people up. You can imagine as a cancer doctor, we're aware of what we do and the blunt instruments that I use to fight cancers. And I know that I have to kill an awful lot of good cells to get to the bad cells. I'm looking forward to them receiving treatments that aren't just destructive and that may have the impact of rescuing them.
So I'm looking forward to locking arms with not only the doctors and the nurses on staff, but also the patients.
We're really excited to have this partnership moving forward. We're really excited to announce that we're forming the doTERRA Center for Integrative Oncology.
Please welcome to the stage St. Elizabeth Healthcare Chief Medical Officer, Dr. Doug Flora.
You and I were good to go. You always kept me feeling good.
Goodbye. That's a great video. I want to take a second before I get started and introduce myself and why I'm here in front of you. To point out, that was one of your advocates on that video. And about a year ago, we started this journey together as patient and doctor. Nicole Chase is one of your platinum advocates. Yeah, we should applaud her. So I'm going to talk equally about some of the medical stuff and what we're hoping to do as a growing partnership between doTERRA and our healthcare system. But I'm also going to talk about the power of one and what one of you did when she was brave for about 20 seconds and hopefully inspire you to understand the difference that you can make. I think our keynote speaker today was fantastic for setting the stage for what I'm about to talk about. I really didn't know what I was getting into when Dr. Osguthorpe and Brannick talked me into coming here. You people are nuts, but you smell really great. I think after watching that video, we're very clear on one thing as a group, that the camera adds 10 pounds, right? All right, so I've got a time limit here. They're timing me. So I'm going to talk today about how we hope to elevate the care of cancer patients across my region and eventually across the country by reframing the way that we talk about caring for cancer patients universally. Obviously, this is a friendly crowd for approaches to holistic and complementary and alternative medicines. I'm a big fan of those. I'm a big fan of using traditional medicines as well. And what we want to do and what we're working very closely with Russ and his team is to make sure we approach these things as scientifically as we can and approach this with the same academic rigor that we would medications as well, to make sure that we're not causing harm in the things that we're doing. And so it's very, very important, and I credit your team. Yeah. So what you may be realizing is how unusual that is, and that's because of all of you out here. The scale of doTERRA has now allowed your leadership team and your owners to spend an awful lot of money doing something that most other companies don't invest in, right? And I know if you're out there, you see the skeptics. I was and am sort of still one until we have strong data on dosing. And the pharmacokinetic stuff you just saw, I nerd out with that stuff. I think it's fantastic. It will come to you guys in a fashion that will make a lot more sense later on. But this is groundbreaking stuff that you're doing here that other companies have not invested in. And so I credit your scientific team. From my perspective, what we're trying to do is change the conversation about cancer from the traditional CT scan-based, chemotherapy-based, toxicity-based, what's the matter with you, to something more like what matters the most to you. And we share that vision with Russ and his medical team. That's important, right? We forget that sometimes. And I want you to understand the doctors who care for you care about these things too, but the constraints of time and the pressures and our requirements in our contract with our patients to really provide the most evidence-based medicine. Doesn't mean that we don't care about the other part, but it means we have a responsibility to you to make sure that we keep you safe first. And part of the research and the scientific studies that Russ and his team are putting together to try and answer some of those questions so that your doctors can feel more comfortable and less skeptical. The second part of this, I'm going to talk about your own advocate and the power of involvement and bravery, and how she was so bold that she brought this partnership together and encouraged the 35,000 odd people here today to think, what can you do in your own communities? Let's move on to another slide. So unfortunately, who is Doug Flora and why is he on stage at this convention? Russ already covered, so I don't really have anything else to talk about. Are there any questions? Thank you for your time. Be safe getting up now. I want to start with my why. Okay, I want to talk about how I came to be here. I'm a cancer patient myself, and I don't know if I've made that clear before. I had a kidney cancer diagnosed October 17, 2017. I went through surgery. I went through all the fear and terror that my patients feel every day. I'm also a practicing oncologist that sees patients in the clinic and understands now from a different perspective dread and fear and anxiety and insomnia. And those are some of the things that we hope these products may ultimately prove to help with. We don't talk about side effect management. We don't talk about things until they're studied. But the goal here in this relationship is to see if we can use your tools to improve patients' qualities of life. So this is where our story starts. It'll be a long story. This is a long-term relationship, and I'm sure I'll be back to give you updates as this goes on. But the short story, as how I came here, is that we announced on my Facebook page and our St. Elizabeth Healthcare page that we were building this $130 million cancer center. And that we were trying to build this around the patient experience rather than around the providers. And that's a novel approach, as you can imagine. Cancer doctors are busy, and the schedules generally are built to our convenience and not the care of the patients. And we've decided to flip that switch, and we're going to do it a little different in our building. Well, Nicole Chase, your advocate, saw that post and reached out to me with this actual text. And you can't read it, but basically it says, hey, what's up? Long time no see. I want to tell you what I do, and I want you to hear about our products, and I wondered if there might be a role for essential oils at St. Elizabeth Healthcare in your new cancer center. And that was about the same time I was asking my own team, how can we take the best possible care of the patient and not just their tumors? And it was a perfect timing because at that point I really wanted to build something that was different and novel, but I needed help. This is a big project where I live, and I'll show you why. Okay, so I don't want you to think I'm a neophyte. I'm a long-time oil user, but I used to pour it on my fan, which I'm told now isn't cool. I didn't know. Apparently it isn't cool. So when I met Nicole came in and shared with me a lot of the scientific literature that she had uncovered. She did a ton of research about this and understood that in our area, we're the lowest, worst tier for cancer patients in the country. Kentucky leads the nation in cancer diagnoses and cancer deaths. We're worse in the country for lung cancer, stage 4 lung cancer deaths, stage 4 colon cancer deaths, and it's really desperate. There's a very high degree of smoking. There's a lot of health literacy issues, and we have a very poor population, and they don't get screened the way they should, and so we're working on that. Interestingly and ironically, Utah, where we now stand, is the best place in the country to have cancer at the lowest possible rate because people here exercise. And obesity is linked to 12 or 13 different cancers. People eat well, and we know food is medicine. People don't smoke and they don't drink, and that's vastly different from where I come from, which is bourbon country, which is one of the best things about Kentucky, but I'll be careful how much I get into that. So anyway, Nicole enters stage left. She comes to my office with reams and reams and reams of paper, and she says, I know you care about this stuff because you took care of me and you cared about the whole person. How can we use what I know and what you know to get together? And so that's where that text originated. She replaced that fan with my first kit. It's now diffusing, so I have lemon and breathe and calm and yes. Still lots of lavender. But she taught me about this stuff, and so that evolved from a skeptic to a convert, right? So here. This is a braggy text I sent my wife as if to say, look at me, I'm a big boy, I'm exercising, even though you didn't make me today. I don't know if you ever got a text like that from your spouse, but I don't do great at exercising without her forcing me to. And I got home from a 6-mile run and I was dying. I'm way too heavy, way too old to be doing that at my age. I should be walking 1 mile. And so I got home and Nicole's bottle of Deep Blue Rub was sitting on my counter and I thought, that seems like that would work well. I hurt everywhere and this seems like it might help. So I used the whole tube. Yeah, yeah. Choose your advocates wisely, because a good advocate would have warned me that there's an appropriate dose and there's a non-appropriate dose. Yeah. So that's in the middle. That night I lied under the covers for about 45 minutes, just skin simmering and thinking that was a really, really good burn. So lesson number 1, do not use a whole tube. Tell that to your people. And I'm sure Russ is studying that dosing strategy right now. So moving forward a few months, and this speaks briefly to the tenacity and the ferocity of Nicole. She's a force of nature. She knew at that point I didn't have the funding to build the things that I wanted to build. She decided on her own volition to go to Puerto Vallarta to one of your conferences and stalk leadership. So she did. She was at a sandcastle contest, working her tail off, carrying water from the ocean to the castle, and cornered Brannick for what I can only imagine was a very startling experience for him. And I think at the end of the discussion, he said he was either going to take a meeting with me to hear more about this, or he was going to get a restraining order against Nicole. We're glad he went with the first, and then we established contact, and that's where this relationship really started to accelerate a bit. Nicole chased him, yeah, right. Nicole chased more people down at leadership in February, and there seemed to be a growing momentum for, let's have an actual meeting. And eventually we had a telephone conference with myself and Russ and Brannick, and I heard later that Mr. Sterling was brought in without my knowing, and they liked the idea, and I guess the word was go out and meet this guy and see if he's legit. So they came to Kentucky. We had tons of bourbon together. No, I'm just kidding. In fact, Russ claims to be a vegan, and he ordered every piece of meat that was on the menu at the restaurant that night, so vegan. So this is our cancer center in April. This is where we stood. As he mentioned, it's a 250,000 square foot facility, 6 floors. But what's important to this group probably is the first floor, which is now going to be called the doTERRA Center for Integrative Oncology. Right. So this is a big deal because there aren't places like this. And in this building, your signage will be everywhere. There will be acupuncture and aromatherapy and aroma touch and medical massage and mindful meditation. Yep. I will be working out in the yoga studio for the first time in my life. It's not a pretty sight, right? We have a demonstration teaching kitchen to teach people about food being medicine, how to eat healthily to affect their health, both before and during and after their chemotherapies. And maybe most importantly for me, as we try to chase this treating the whole person, not just the tumor, I had funding to hire our first ever director of integrative oncology, and she's fantastic. So moving on a little bit, I'm going to try and stay on schedule. The video that you just watched was filmed a couple weeks ago, and Nicole advised me it was exactly 1 year to the day from when she took me off her chicken list. That's what she calls the list of people she is afraid to call. Do you all have one of those? That's cool. I've never heard that. I'm scared to call everyone. She was brave enough to do it, and she said it was a really big deal for her because I was her treating cancer doctor, and she was encouraging maybe a not traditional route for our cancer center. And she said she actually sent that text that you saw and then threw her phone across the room as if she was going to be able to take it back, which obviously that didn't work. I think it's crazy that we're a year into this now. We've got a formal 10-year relationship now with doTERRA as we work through these clinical trials, as we work through this center. We're honored for this, and I think for you all, what may be important is that they're challenging the old paradigms of traditional medicine with Prime Meridian by studying the use of essential oils with real scientific rigor, and we're excited to participate in that. As we opened the center, we moved this process forward. The thing that struck me was that this was the power of one single individual in this room last year, right? That's awesome. So she decided there was a need. There was a problem that needed solved in her community. She recognized that there was an opportunity, and she did bold things, and she was brave. And I would encourage those of you who are in your own communities and your own businesses to look outside of what's typically done and try and stretch that and try and say, what makes me uncomfortable? That's probably the right thing to do. We've already established it's super great and highly encouraged to stalk your leadership at conferences. Emily over there, they're loving that part, right? They're less likely to do restraining orders after this experience. We know now that fans are not diffusers, so we've learned a lot about that. We now know the appropriate dose of deep blue rub is not 1. LOLLL. And we now know that there's going to be a doTERRA Center for Integrative Oncology in Kentucky at ground zero for cancer. So as I approach my close, I'd like to ask for a minute of indulgence. I'm going to play a 46-second video about this that I think resonates well. This is a message that my children receive at home. It's something that I really believe in. I think it might leave you with an idea where we are right now.
I guess I didn't listen to something she told me or something. And I liked her. It's like you embarrass yourself if you say something. You embarrass yourself if you don't.
You know, sometimes all you need is 20 seconds of insane courage. Just literally 20 seconds of just embarrassing bravery. And I promise you, something great will come of it.
Right? How much cooler would I have been in high school if I knew that rule? So I thank you for your time. I thank you for your energy. I'm excited to be here and see the spectacle that is this conference. I'm excited for our partnership, and I want to reach out and thank Brannick and Russ for inviting me into their lives as now good friends as we've spent many, many months working through this. And I look forward to coming back in future years and telling you all the good that we've done for these patients. Thank you.